Hi, I'm Dr. Stephanie Barto with Barto Family Chiropractic. We are in the midst of back to school season, and what I'd like to do is share tips on how we can make this a healthy and happy school year for your child and family. The first tip I'd like to share is backpack safety. We often check posture in the office because your posture is a window to your spine and nervous system. If we see dysfunction in how your spine is aligned on the outside, then we'll also see changes in how your brain and body communicate through the nervous system. If we look at this little guy in the picture on the left, you can see what his posture looks like without a book bag. While it's not ideal because his ears should be over his shoulders, when we look at him wearing a book bag, his head shifts even more forward. And if you look closely, this shift now starts at his hips to compensate for the weight of the book bag. When we wear very heavy book bags, especially for long periods of time, think like middle or high school children who may carry many books with them all day, then those postural changes begin to set in to the point that it's not possible to fix by simply standing up straight. So what we're really talking about here is called forward head posture. For every inch your head is relative to your shoulders, it increases the weight of your head by up to 10 pounds as far as the muscles in the neck and shoulder are concerned. So you as a parent, if you often feel tension across your shoulders and your neck, that's often because we spend a lot of time at our desks or in other positions that pull our head forward, and it puts a lot of stress and strain on those muscles. And that's exactly what happens to our kids when they're spending all day long in desks and carrying heavy book bags. Now this is critical because this singular posture change has far-reaching effects on your child's overall health and well-being. First, biomechanically speaking, it's impossible to fill your lungs fully. Go ahead and try it. Hunch yourself forward and try to take in a deep breath. And then sit up straight, and when you take a deep breath, notice how much more air you can take in. If we can't fill our lungs and we have less oxygen reaching our entire body and brain, obviously that's critical to overall health. Now this has also been shown scientifically to decrease testosterone production, so our hormones are impacted. It also increases stress hormones like cortisol. So when your kids come home and they're exceptionally stressed out, it can be in part because of these heavy book bags. Lastly, forward head posture has been associated with a decrease in serotonin, which results in your child feeling poorly about themselves. This is really important. When we see these postural changes, it stresses our kids out and they feel badly about themselves. So what are we as parents able to do to help our children? We need to teach our children proper backpack safety. As teachers and parents, we can help our kids better manage the weight of their book bags. Any book bag that weighs more than 15% of a child's weight is too much, and it can damage their developing spine. So let me repeat that. No more than 15% of their weight should be in their book bag. So what does that look like? Well, if your child weighs 50 pounds, they should not carry any more than 7.5 pounds. So look at these little girls. They are definitely carrying more than 15% of their body weight. Actually, 10 to 13-year-olds on average carry a book bag that weighs 25.3 pounds. That's 3 times their recommended load. So teachers, make this a little math lesson for your students. Parents, you can do the same at home. Weigh your children, then weigh their book bag. If you have to have your child wear the book bag to see the difference in the weight, then do that. But do the math to find out what percentage of their body weight is the book bag. Now to help accomplish keeping that book bag under 15%, every Sunday, empty your child's book bag and everything that is not necessary. Additionally, we need to make sure we're wearing the book bags properly. Check the straps for proper placement across both shoulders. Also, choose a book bag that has padded straps. Otherwise, those straps can dig into their shoulders, and as you can imagine, that's going to be very uncomfortable. The bottom of the book bag should be about 2 inches above the waistline and should rest in the curve of the low back. You can see the difference in this posture. So on the pic on the right, the book bag is too low, leading to greater compensations. So tighten those straps to raise the book bag for a much stronger posture. Additionally, we need to use both straps. Don't purchase a book bag without two straps. Teach your child that wearing both straps prevents spinal problems. This is a nice illustration to show you what happens on the inside while wearing just one strap. This is magnified if you're dealing with a lot of weight. That stress on the spine will affect the nervous system and impact overall health. That may not be obvious right now, but perhaps your child will become one of those adults that come into my office in their late 20s or 30s with unrelenting back pain and other health problems with no obvious cause. Sometimes these things go back to really simple things when we're growing and developing. To help offset those times that a heavy book bag can't be avoided, we should be practicing spinal hygiene exercises to strengthen our spine. If you're a patient in the office, what you're seeing here are a few of the YWTL exercises that will balance the muscles across the chest and the back. Additionally, if your child is not under regular chiropractic wellness care, or if they have never seen a chiropractor, then take a close look at their posture. You want to check your child's head and shoulders at least once a month to determine if there are any signs of repetitive stress on their growing spine and nervous system. Take a close look at this little fellow. He has a shoulder imbalance that translates to a difference in how his hands hang at his side. One side is clearly longer than the other. His eyes are also uneven, and he's rotating his head to the right. If you're noticing any asymmetries in your child's posture, it's a clear sign that there is stress in the nervous system that needs to be further evaluated by a pediatric chiropractor. It is not a matter of having your child stand up straighter, because by the time these postural changes occur, it means the neurological changes have already set in. In our office, we actually have testing that can demonstrate to you as the parent where stress exists within your child's nervous system. We are committed to doing these tests regularly throughout care so that we can continuously monitor progress and adjust our recommendations appropriately. Your child's health is just as important to me as it is to you. So for that reason, I'm never going to guess at what may be happening. I'll use objective testing to know for sure and always share that information with you. Parents whose children are under regular chiropractic wellness care report the following benefits: improved sleep, improved immune function, which means fewer sick days for them and fewer sick days for you as the parent, improved behavior, improved concentration, which is going to lead to improved grades. All of that from children who receive regular chiropractic care. So if your child has not yet been evaluated by a pediatric chiropractor, then I have a special offer for you. During the month of September, we are offering you the opportunity to have your child's spine evaluated for just $97. That'll save you $50 from our typical fees. And we'll include a complimentary review of findings so that we can review any significant findings as well as our recommendations to help your child grow and develop optimally so they can be their best self. So give our office a call to schedule and mention this back to school special to receive the discount. We look forward to helping your child.